Good evening. My name is Dr. Melody Rodarte. I'm a physician in Arizona in the Phoenix area. I'm double board certified in internal medicine and obesity medicine and have several certifications in hyperbaric medicine, wound care, and medical aesthetics. And it's just all complicated to say. I love being a physician. I love taking care of the whole patient. And I really enjoy preventative adult medicine because I believe that we can empower ourselves to have incredible health. That's been my journey. And since I was a child, I wanted to be a physician and I wanted to empower my patients to take control of their health, to not settle for the diseases that might be in their family lineage. And to know that they can be an active part of the healthcare system. In the past 2 years, I think that is so imperative and important for you to take control of your health and how you age. And I love teaching on it and sharing my experiences as well as my knowledge. So hopefully tonight you will maybe learn a few words that you don't know. And you might learn some pathways that you don't know yet. Again, I love education. And whether or not you decide to put this into practice, I'm just thankful that you are here and taking a listen. And if it's something that you think might help someone else, that you decide to share this with them as well, because we're all on a journey. And sometimes things are not as important in that direct time. And in a few years or a few minutes or a few days, we might think, oh my gosh, that was something that I think I needed to listen to or I needed to incorporate. And again, in the past 2 years, I think it's ever so important that you take control of your life and your health. So with that, I'm going to share my screen and we will get started. Oh, it might not show my screen. Well, all right, you all. Well, I apologize. Hopefully, I'm going to turn my phone on. Someone can send me a message. If you can still hear me, that's great. I think I'll just end up talking. I apologize. I'm not sure why I cannot share my screen this evening. This is a new one for me. Not had this happen. So let's talk. Let's be honest. All right. So whoever invited you to this webinar, what I want you to ask them to do is share an ABC Primetime Investigative Report with you. If you haven't watched it, it's incredible. It's really what was shared with me about 8 years ago when I was looking for something to reduce the oxidative stress in my family, specifically my son, who had an autoimmune condition. And so if you haven't heard of that term, oxidative stress, it's the natural wear and tear that's happening inside of our bodies and our cells. It's the aging process. And so what happens is, as that stress can actually happens to that cell, it can affect our organ system. It can affect how we age, and depending what your gene makeup is and what mine is, and your family, it might look like a myriad of different I'm going to say the word disease states. So you can think of high blood pressure, high cholesterol, all of those things, illnesses that deal with the gut and the brain. So oxidative stress is that driving factor. And so why we care about reducing oxidative stress is we're trying to reduce that process from one starting and two progressing. And so the question I get a lot of times is, can I reverse it? And the answer is yes. Our cells are multiplying, they're healing, they're recovering. And so what you do on a daily basis will make a difference on how that cell ages, how your body ages. That's why I love preventative medicine. So you want to reduce oxidative stress to slow down that aging process. So if you watch that ABC primetime investigative report, you got to see John Quinones's blood, his oxidative stress level decrease by over 40% within 14 days. And when we look at the study that was actually published that really put the product Protandim on the map, you were able to see that reduction in 30 days. And with the continued use of the product, you saw over 70% reduction in oxidative stress. So that's why we're here tonight. And that's why I'm here tonight, because I got to see that primetime investigative report, and I got to see what has happened in my own blood and in my own life. When I was able to really dive into this product, I went to a place called PubMed. And it's where the National Institute of Health, it's a library of peer-reviewed and published data. And so as a physician, I rely on this site to do my research. And in the past, when a patient would bring me something, or a drug rep or pharmaceutical company would bring me something, I would go to PubMed to see what the latest research was. So 8 years ago, when I saw this primetime investigator report, I typed in Protandim. And I can't believe that there were 16 peer-reviewed studies. Tonight, if you go to that website and you type in Protandim, Protandim, you're going to get over 30 studies. And to me, that's exciting because it's on the branded product. It's not on individual ingredients, which are ashwagandha, bacopa, milk thistle, green tea, and turmeric. It's actually on the product itself, the branded product. And so that's what really caught my attention and made me think, okay, what if this could reduce the oxidative stress that these studies are talking about? And that's where my journey started with this and has continued. I feel blessed. I sit on the scientific advisory board, and so I get to hear even more. And I've decided that this is something that I want to carry in my practice now. And so I do have my own practice for the last 2.5 years, and been in practice for over 15 years, which is crazy to say right now. But in this past month, we actually took that technology and we wanted to expand it. And so we know the importance of one of the antioxidants that we produce, which is called superoxide dismutase. So we have put together a collagen. And so it's a lot easier to talk about a collagen because many of you are probably using it daily, whether it's in a shake or a drink or a capsule, because you're trying to maybe help your skin, hair, and nails, or you heard it was great to help your GI system or your joints. Collagen is in every cell, and it helps the cell structure maintain itself, and it's really needed for function. And so we have released a collagen that can also activate collagen, maintain collagen, and replenish our collagen in our body, which is really, I'm going to be honest with you because I have no slides to show you. I'm going to be honest with you. I was a little nervous when we thought about, as a company, bringing on a collagen, because as a physician, I already tell people to take collagen, and I thought, well, there's plenty around. Why as LifeVantage do we need to release a collagen? Well, and that's when I realized that we were going to do 3 things, and there wasn't another product that was doing 3 things at the same time. So we activate, we replenish, and we maintain. So with this product, I became excited during the trial as I saw friends and colleagues starting this and kind of seeing what was happening and monitoring their results. And what we want to do is, help our skin, hair, and nails, because we're thinking on the outside, but what if you start, activating from the inside those structures? And so with the ruby red quinoa extract that's in it, that is our activator, and it's actually increasing superoxide dismutase, just like Protandim does, which is an incredible antioxidant to reduce inflammation. So anyway, we have the peptides are from fish collagen, and then we have berry extracts in there for the vitamin C, which is very beneficial, and for those other antioxidants that we need, because we still need to eat well. So if you go all the way back to the beginning of what I was talking about, having an excellent diet is imperative, because our daily nutrition makes a difference to how we function and how we age. Then on top of that, you want to activate those key parts in your body to help you out so you can go ahead and release those antioxidants that in turn reduce oxidative stress, which is our key, right? So we've taken that NRF2 activation story and we've just been able to put it into other products. And I apologize that I don't have my slides because they're great. They're really informative. You could have taken pictures and had a better conversation, but you got to hear me talk for a little while. And with the last part I'll leave you with is, why are you listening to me on this webinar? And that's because if you aren't here in Phoenix and can't see me as a patient, I love that I can teach and train teams in order to help the health of those globally, worldwide. And that's what kind of company we are. We're a company about health, about biohacking. It's another term if you haven't heard about that, biohacking the aging process. And our goal is to really improve the health of others. And in the same time, have something that we can share in order for those of us who are looking for a side gig or a main gig. For me, it's been beautiful to do this for the last almost 8 years. I can't imagine not being able to share this with others. And so with that, it's a quick 15-minute presentation here. Again, I apologize that my slides didn't pop up. Hopefully, whoever invited you to, if you like the way I present, I've got a couple of recorded ones, and hopefully we can get a better one out there for you guys. But again, thank you for this evening. It's been an incredible journey for me. I will continue to teach on these products because I myself want to slow down the aging process. I want to help my patients naturally, as well as my friends and my colleagues. So with that, thank you so much for staying tuned, and hopefully I'll get this fixed. I was so excited I could log on with the new password and everything, but apparently I should have checked that my slides popped up on the screen. So have a great night, everyone. Good night.